right team. We have a patient with symptoms of ophthalmia, myocarditis, and perichondritis. What are we thinking here?
I'm leaning towards some sort of rheumatic disorder, possibly rheumatoid arthritis.
I see where you're coming from, Gary, but what about a connective tissue disorder like Ehlers, Danlos syndrome?
I'm thinking it could be something more rare, like progressive pseudohematoid dysplasia.
Bingo, Frank. It's progressive pseudohematoid dysplasia. We need to act fast. Prepare for anterior temporal lobectomy.
But that's a risky procedure, Hawks. Are you sure it's the right call?
Damn it, Gary. I've been in this field for over 20 years. I know what I'm doing. Trust me, this is the best course of action for the patient.
All right, let's do this. We need to save this patient's life.
I'm with you, Hawks. Let's get ready for the surgery.
Tracy, I need to talk to you about performing an anterior temporal lobectomy on my patient with progressive pseudohematoid dysplasia.
Hawks, are you sure about this? That's a major procedure to consider.
I've been in this field for over 20 years, Tracy. I know what I'm doing. Trust me, this is the best course of action for my patient.
I understand your experience, Hawks, but we need to be cautious when it comes to such invasive surgeries.
Of course I have, Tracy. I wouldn't suggest this if I didn't believe it was absolutely necessary. My patient's quality of life is at stake here.
I appreciate your dedication, Hawks, but I just want to make sure we're exploring all possibilities before moving forward with such a risky procedure.
I can't believe you're questioning my expertise, Tracy. I know what needs to be done, and I won't let anyone stand in the way of me helping my patient.
I'm not questioning your expertise, Hawks. I just want to make sure we're making the best decision for the patient. Let's discuss this further before making any final decisions.
Oh no, the patient is in critical condition. This isn't good. I need to figure out how to tell Hawks that the anterior temporal lobectomy was not the right treatment for progressive pseudohematoid dysplasia. It's a delicate situation. I have to be honest yet compassionate when delivering this news.
You incompetent fools. How dare you nearly kill our patient with your reckless decision-making? You performed the wrong anterior temporal lobectomy and misdiagnosed the condition.
I'm sorry, Hawks. We did our best to analyze the situation.
I still believe our initial diagnosis was correct. The symptoms matched up perfectly.
Maybe we should reconsider our approach next time. We can't afford to make mistakes like this again.
Reconsider. You all need to reconsider your careers if you can't get a simple diagnosis right. I can't believe I trusted you all to handle this case. You should be ashamed of yourselves. Storms out of the room. I can't believe I still can't figure out what's wrong with this patient.
Maybe you need to look at it from a different angle. Have you considered the potential allergies they might have?
I did, but test came back negative. It's frustrating.
What about a possible infection? It might be worth a second look.
No, I already ruled that out. Wait a minute. I think I know what it is.
Seriously, what is it?
Excitedly, it's a rare genetic disorder I read about last year. Thanks for the suggestions, Johnson. I've got to go check on the patient. See you later.
Confused. Okay, see you later, Hawks.
I'm sorry for the interruption, but we need to make a change here.
Hawks, you can't just barge in here without proper equipment. This is a sterile environment.
Yeah, you can't just disregard protocol like this.
What's going on, Hawks? Why are you here?
Progressive pseudohematoid dysplasia was a misdiagnosis. The real issue here is infectious diseases among athletes. Tracy, I finally found the right diagnosis for the patient.
Congratulations, Hawks.
If you had just listened to me in the first place, we wouldn't have had this whole ordeal with the wrong diagnosis.
But that wrong diagnosis almost killed the patient, Hawks. You should have trusted my judgment.
Your judgment almost cost us the patient's life, Tracy.
My decisions are based on years of experience, Hawks.
Experience doesn't always mean you're right, Tracy.
We need to work together, Hawks, instead of constantly clashing.